Could you please introduce yourself to the members of the jury and spell your last name for the record?
Sure. My name is Dr. Bran Hertz. That's H-E-R-T-Z. And I am a family physician at Miami Family Practice and Wellness Group.
Dr. Hertz, could you describe your educational background?
Sure. So I graduated from Steelton A&M with a degree in organic chemistry, which is not easy, let me tell you. And I did that in '88. From there, I went straight on to the Steelton College of Osteopathic Medicine, graduating in '92. And then I did a 4-year residency, and in my last year, I was head resident.
Dr. Hertz, you mentioned something called osteopathic medicine. Could you just briefly describe what that is?
Sure. So doctors of osteopathic medicine, DOs, and MDs often work together in a family practice setting. We are both qualified to diagnose, treat, and prevent illnesses. But for osteopathic medicine, we really believe that, and I think most people believe, that an injury or an illness is not isolated to just the single body part that it's affecting, but it affects the whole person. And so I treat the whole person.
Dr. Hertz, do you have any other qualifications in your field?
Well, I was board certified in family practice back in '97, if that's what you mean. I've also been published numerous times, and I have been volunteering with Doctors Without Borders since 1999.
Dr. Hertz, why are you here today?
I was asked to offer my opinion on whether the care provided by Dr. Condon was reasonable.
Well, we'll get to your opinions in a second, but first I'd like to ask you, what facts and data did you rely on for this case?
Well, I was provided with a full case file with relevant information for this case that included all the depositions, including both depositions from Mr. Bobby Daly, as well as the full joint exhibit list, which included most relevantly the medical records from Dr. Condon when he was treating Mr. Daly. I also researched the relevant medical literature and relied on my own extensive medical background.
Dr. Hertz, was this a sufficient amount of facts and data to come to a conclusion?
Yes, I had more than that.
Did you use any reliable methods when coming to your conclusion?
Yes, I use a method that I learned in medical school and is practiced by all of my colleagues at Miami Family Practice. I like to refer to it by the acronym HEAL, that's H-E-A-L.
Dr. Hertz, I'd like to take that acronym one letter at a time. Could you tell the members of the jury what the H stands for?
Sure. H is for health records. So the first thing I do in any sort of comparative analysis like this is I look at the health records that the treating physician had available to them when they made their diagnosis.
Well, what about E? What does the E stand for?
E is for evaluations. After looking at these health records, I look at how the treating physician evaluated them to come to their diagnosis and treatment plan.
The next letter, A. What does the A mean?
A is analysis. So from there on, I go to my own analysis using the relevant medical literature, like you described, and decide whether or not the treatment and diagnosis was reasonable in light of those health records.
Dr. Hertz, the last letter in HEAL, L. What does the L mean?
The L stands for lapse in care. So after I finish my analysis, I always want to go back and just double check to make sure that there was no lapse in care or treatment that would violate the medical standard of care.
Dr. Hertz, this method of comparative analysis that you've just described, is this commonly used in your field?
Very common.
And Dr. Hertz, did you apply this methodology appropriately to your facts and data?
I did.
With all of this in mind, what conclusions were you able to reach?
I reached 2 different conclusions. The first one is
Objection,
that-
Your Honor. Lack of foundation under 702, may I be heard?
Yes.
Your Honor, under 7, in order for an expert to testify in the form of an opinion, there must be certain foundational prongs met. They're discussed in 702 A through D. I'm specifically objecting to prong D, that this expert reliably applied this methodology to the facts of this case. When asked whether she did, she simply stated yes, without giving us any idea of how we know that she actually was reliable. We're asking whether she can testify as to whether she applied it as it's lined out in medical literature, as she's taught in medical school, anything like that that gives us an objective way of knowing whether she actually applied this analysis reliably. As of right now, that's not on the record.
Your Honor, may I?
Yes.
Your Honor, we've laid extensive foundation to satisfy the prongs of 702. If opposing counsel wants to get into the application of this method, he's more than welcome to on cross-examination.
I was going to say that myself. But go ahead.
Your Honor, the prongs of 702, there are requirements that an expert must meet before being able to give any sort of opinion. Therefore, it's not enough for me to simply go into it on cross.
Why not?
Because Otherwise, we do not know whether these methods are in fact reliable. Because that form of information so far is not on the record. And without that information on the record, members of the jury will not be able to tell whether this information, her opinions, actually are reliable.
You're ahead.
I'll get out of my own way, Your Honor.
Good. Overruled.
Yes, Your Honor.
Dr. Hertz, could you tell the members of the jury what your conclusions were?
Sure. So as I was saying, I had two. My first conclusion was that Mr. Daly, his symptoms were consistent with that of post-concussion syndrome. My second conclusion was that Dr. Condon's treatment of Mr. Daly was both appropriate and consistent for someone with post-concussion syndrome.
Dr. Hertz, I'd like to take your conclusions one at a time. Your first conclusion was that Mr. Daly's symptoms were consistent with post-concussion syndrome. Let's take a step back. Could you describe to the members of the jury what a concussion is?
Sure. So quite simply, it's a brain injury. Our brains are surrounded by some spinal fluid that keep them from being too jostled around as we move around. But even a single hard impact to the head can cause your brain to move through that fluid and strike the inside of your skull. That causes a concussion.
In your professional experience, could you just describe some of the ways in which a concussion can happen?
Oh, sure. So you may have a spouse that falls down the stairs, a child who decides to do a new cool trick on their bike and falls off. Your grandparent may suffer a fall and injure their head. Or you may have someone in a car crash whose head hits the steering wheel or the dash, or if they're not wearing their seatbelt, goes through the windshield. Or, in this case, of Mr. Daly, they may be assaulted and be hit in the head multiple times.
Dr. Hertz, what are the symptoms of a concussion?
So, someone experiencing concussion experiences numerous unpleasant symptoms. Often you may see things like gaps in memory, loss in focus or concentration, severe headaches like migraines, blurred vision, or even mood changes.
Dr. Hertz, with this in mind, what is post-concussion syndrome?
So sometimes after someone has experienced a concussion, even after that concussion is healed, they may still be experiencing the symptoms of the concussion, and that's what we call post-concussion syndrome.
Dr. Hertz, I'd like to take what you've been telling us and apply it to this case more specifically. Are you familiar with the symptoms that Mr. Daly reported to Dr. Condon?
Yes, I reviewed all the depositions and the medical records.
What were those symptoms?
Many of what I described before. He had the severe headaches, the gaps in memory, the loss in focus, the blurred vision, the mood changes.
Dr. Hertz, earlier in today's trial, we heard some testimony about whether or not Mr. Daly had been falling over. Are you familiar with whether or not that was happening as well?
Yes, if I remember correctly, in the medical records, there was an instance where Mr. Daly reported sitting on the couch and then waking up lying down on the couch or near it.
And what does this tell you?
That he was having balance issues, which is a symptom of post-concussion syndrome.
So, are the symptoms that you've described also indicative of any other conditions?
Most relevant to this case, some of those symptoms do overlap with a seizure disorder, but not all of them.
Dr. Hertz, based on your professional medical opinion, which diagnosis do you believe was more likely for Mr. Daly?
Post-concussion syndrome.
Why?
Well, Mr. Daly, no one argues that he was hit multiple times in the head. And so all the symptoms that he presented are most consistent with post-concussion syndrome. So it's my opinion that he suffered concussion and then as a result developed post-concussion syndrome.
Dr. Hertz, I'd like to move on to your second conclusion. That conclusion was that Dr. Condon's treatment of Mr. Daly was appropriate. Can you describe what exactly Dr. Condon did?
Sure, he did a few things. One of the first things he did was prescribe a medication called gabapentin. He also counseled Mr. Daly on safety and on healthy living. And over the course of numerous appointments, he kept track of Mr. Daly's symptoms and monitored them for any alarming changes.
We've heard a lot today about a drug called gabapentin. Could you describe what that is?
So gabapentin is primarily prescribed for two different reasons, postherpetic neuralgia and to treat partial refractory seizures.
I'm sorry, Dr. Hertz, what does that mean?
Sorry, I'll slow down. So postherpetic neuralgia is nerve damage that's a result of the shingles virus. Partial refractory seizures are seizures that can't be treated with anti-epileptic medication alone. They're not responsive to it. And as a result, gabapentin has been cleared as an add-on therapy. So when you keep that anti-epileptic drug and you add gabapentin, then those seizures start to reduce.
Dr. Hertz, can you use gabapentin by itself to treat seizures?
That would not be an on-label use, and there's no clinical trials that suggest it would be effective.
Dr. Hertz, you mentioned on-label. Are there off-label purposes to using gabapentin?
Yes, several.
And could you describe what off-label means?
So every drug in the United States comes with an FDA-approved label on it, and that little patch on your pill bottle. What it means is that that's the purpose for which that drug has been cleared based on the manufacturer's clinical trials. But many drugs have off-label purposes, things that aren't described on the label, but are just as effective.
And to be clear, are off-label purposes of a drug any less legitimate than on-label?
No, not at all. So, for example, you may have heard to take aspirin if you think you're having a heart attack. Aspirin isn't prescribed for heart attacks, but it works as a blood thinner and can help prevent them. That would be an off-label purpose. And many doctors commonly use drugs for their off-label purposes.
Dr. Hertz, are there side effects to gabapentin that you're aware of?
Yes, there are several side effects. Most commonly, some alarming ones that I noted were that in clinical trials, almost 20% of participants experienced dizziness and somnolence, which means sleepiness. Some other ones included nausea, amnesia, the list goes on.
And in your professional expert opinion, what should you do if you're prescribing gabapentin in light of these side effects?
Well, the gabapentin medical data that doctors have available to them instructs doctors and pharmacists to warn patients taking gabapentin that they may experience higher rates of depression, if that's an issue for them, and some suicidal ideation. It also instructs that you should warn your patients not to drive or operate heavy machinery until they're used to the effects of gabapentin.
Dr. Hertz, with all of this information in mind, in your professional opinion, was it appropriate for Dr. Condon to prescribe gabapentin?
Yes, gabapentin has many off-label uses that fit Mr. Daly's particular medical record.
And based on your review of the record, did the gabapentin have any effect?
It had a positive effect on Mr. Daly's symptoms.
And Dr. Hertz, based on what you were able to review today, could you conclude if Mr. Daly had a seizure disorder?
No, there is no definitive evidence to let me say for certain that Mr. Daly ever suffered from a seizure disorder.
Based on that, should Dr. Condon have treated Mr. Daly for a seizure disorder?
No, it wouldn't be good medical practice to treat your patient for something that they don't have.
Dr. Hertz, did anything that you reviewed for today's case suggest if Mr. Daly had a seizure while driving on September 4th, 2016?
Again, there's no definitive evidence to suggest that Mr. Daly ever had a seizure.
Thank you. Nothing further.